staying with ingrowing toenails, but moving on from the somewhat controversial nail bracing, I just thought I'd do a little bit of real basics revision stuff. This is things that everybody should know and should already be doing, but it's always good to revisit them. So 5 things to do when you are conservatively treating an involuted, painful toenail. So the first thing you need to do is to know your enemy. You need to know what it is you're dealing with. Before you even think about picking up a pair of nippers, fabulous Shonky model TM, as I'm sure you can see. That's a nail, and the black bit there is the skin. You need to ease the skin back to see what you're doing. Your blacks file is not simply for filing the edge of the nail, it's also for exploring. So keeping the nail sort of parallel to the file parallel to the nail, you just very gently ease all of that back, and you really want to find the edge of the nail at the point that you want to cut it to. What you don't want to be doing is cutting in the dark to actually sort of just hope for the best, hope that you're going to hit the edge. So before you start, clear the debris out, and if you can, just find the edge of the nail with your blacks file. When you've done that, second thing you need to do is choose your weapon. Everybody should have ingrowing toenail nippers, preferably a selection of them, because sometimes they'll need to be stronger, sometimes they'll need to be thinner. But if you generally use a sort of standard nipper like that, you do not want to be going down the side of a nail with one of those. At the very least, you want to have something this sort of size. Just show there for comparison, so that what you're having to slide under the nail is much finer, and preferably you want to have some even smaller ones than that for kids. And you need to keep these for just going down the edge of involuted and ingrowing toenails. The tips will by definition be much finer, and if you use them for regular stuff, what will happen is the tips will bend. So regularly check them and make sure that the tips actually meet right to the very tip. The 2 things that knacker ingrowing toenail nippers are, number 1, using them on bog standard everyday nails. They're not designed for that. And number 2, people removing scalpel blades with them, or indeed any nippers, will knacker the tips. If the tips of the nippers don't meet, if there is a gap in between the end there, then you won't get a clean cut. When you actually go down the side and do your nip, it will tear slightly. It won't do it cleanly, and it won't leave a nice smooth edge. So my advice would be get some sterilizing pouches, get 3 or 4 sets of ingrown toenail nippers of various sizes, and pouch them up separately, keep them in your pack, and just use them for the edge of the nails, nothing else. Just keep that one tool for that one job. And just for reference, these are Thwaites nippers. This is a different type of nipper again. This is what we use for doing nail surgery, or this particular set is what I use for stripping wire, which is why it's a bit chunky. It will have a flat side and a pointy triangular shaped side. I don't know if I can focus on that. And these are not designed for routine use. If somebody is not anaesthetised, if somebody's not had an LA, don't use these. So if you see Thwaites nippers and wonder what they're for, they are only for nail surgery. Okay, number 3 is a little bit controversial, and that is to weaken the nail before you attempt to go down the side of it. This is obviously not something you would do with a healthy nail, but where the nail is thickened is corkset. Sometimes it can be helpful to use a burr just to thin the bit of nail that you're about to cut. The technique for this, you probably want to have somebody show you if you're not confident on this one, but I'll try and demonstrate it as best I can. So this is a Morse disc. Ideally you want a small Morse disc with a fine grip for this. This is a large one with a coarse grip, but that's all I had handy. I'm going to peel back the skin, which you do as much as you can, and then very gently just smooth and thin that edge of the nail that you're going to be cutting. The idea here is that when you do actually cut, it's easier to do. Obviously be very, very careful. This is a circular saw. If you go down there, then that will cause problems. So you are only doing the side of the toenail, but it should be quite easy to be very precise about that. And as long as the drill is set to a low speed, even if you do touch the skin, it shouldn't cause a problem. So you just thin that down so that when you do come to make your cut, it's a bit easier. What you're doing there is increasing the compliance of the nail. You're increasing the flexibility of the nail. If that is absolutely rock solid, then when you try and get your nippers underneath it, like so, the nail is not going to bend, so it's just going to push the nippers down. If the nail is a little bit flexible because it's been lifted, when you do put the nippers under, the nail will actually flex up very slightly, and it doesn't actually hurt the patient as much. So next one, you've found the edge, you've used your probe, you know that that's the point you want to cut to, and you've decided that that is the line you want to cut, because that gives you a nice straight edge relative to the toe. So you know that's the cut you want to do. The next thing you need to do is be mindful of the angle of your nippers when you make the cut. There is a temptation, because we are going into a toenail that way, I'll try and do this end on so you can see, to hold the nippers, to make the cut like that, to keep the nippers upright like that. But if you think about it, what we want to do here is actually go at right angles to what we're cutting. If you're cutting plain like that, you want to be cutting like that. If it's going that way and you keep your nippers in that plane, you're actually cutting diagonally across it. So you want to be going across at the thinnest point, not that point. And if you look at the angle of the nail, that's actually going down. So in order to cut perpendicular, your nippers don't want to be upright like that. They almost want to be there. So that when you cut, it is flat to the base plane. And there's your nice level cut. So the next thing, just to recap, don't assume that the nippers need to be upright and at 90 degrees to the plane. Keep the nippers at 90 degrees to the bit of nail that you're cutting, which might mean you have to even go all the way around there. For that nail, for example, where it's actually double back on itself, I want them at that angle. So don't always assume that the nippers should be right. And last but not least, when you're done, if it's a lateral sulcus, you always want to wedge between the first and second toe. You can use a silicone wedge like this, you could use a bit of felt, you could use a bit of rolled up perm cotton wool, a bit of rolled up loo roll. Doesn't actually matter what they use, but the main thing that goes into the side of that is of course that toe, and when you've just cut it back, it's going to be a little bit sensitive, it's going to be a little bit sore. So just as a routine thing, every time you do a lateral sulcus, just stick a wedge between the second and first toe so that the second toe is not pushing in to the end of the first. You will find your patients are much more comfortable and your outcomes are better. Just a little addendum just for Sarah. The question was asked, why not use a needle burr to go down the side instead of a Morse disc? There are people who use needle burrs, and that's absolutely fine and fair enough and good and dandy. And if that's what you're used to and what you're good at, then crack on. There's a reason I prefer a Morse disc, which I shall explain to you now. Let's say this is our nail, and the black area represents what we want to cut. So that's going to be the section that we will take off. What we need to thin is all of the black section, most especially the line that we are going to have to cut, and a little bit in that hatched area as well. We want to sort of increase the compliance of the nail there, make it a little less bendy. If we're using a needle burr, first of all, a needle burr obviously is deeper. This is not a needle burr, but it's the closest thing I've got at the breakfast table. So what you would have to do is start off, obviously you need to be in line with the nail, because if you go down that way then you've got a point going there which is a bit dodgy, And you either got to sort of thin it in a movement coming up, or you've got to go from there and use that movement, or from there and move that movement, which seems a fairly complicated way of doing it. If you go in a bit too far at any point there, you create a ridge or a weakness. And if you were to sort of go straight down and out, that would work. But again, you've got to sort of make sure that you keep the thinning even throughout the whole bit there. Whereas with a Morse disc, of course, the surface that you're thinning with is flat. So you don't have to worry about that. You can literally just go down like that, and you're covering a bigger area of nail. So yeah, there's no reason, and of course a Morse disc is thinner, so it's easier to go down the side. So there's no reason you can't use a needle burr for this, but I would suggest you try the Morse disc, because as I say, it's a flatter area, so it's easier to evenly reduce the nail.